earmarking enough. I mean, you have complained of underfunding of the healthcare sector, and you're looking for more money. But then there's also effective spending, efficient spending of the monies that are allocated, ensuring that whatever it is that goes there, the little that we have there is showing. I mean, we're getting value for money for whatever it is that we spend there.
Well, Nigeria is a country where people cry wolf when there was none. People talk about corruption, but it's difficult for them to bring to the table real evidences to justify that allegation. You recognize that there was even a press release by USU saying that it is not the human resources, it is not funding that is mitigating against delivering health, but the corruption in the health sector. I can see it. Do you know the real corruption? About 80 to 90% of the resources is used to pay people. That, to me, is the corruption.
Used to pay salaries, you mean?
Yes, salaries. That's the corruption.
You think it's corruption to pay staff their salaries?
When they are not delivering the service, is that not corruption?
You mean when they're on strike?
Even when they are not on strike, are we measuring the input?
Whose job is it to measure it then?
Are we measuring the input? That's why I've directed CMDs to do audit. Find out, are people really working? I was instrumental to a Nigerian getting a position in Northwestern University. It's just been made a chief of infectious disease. The last time I had a conversation with him, he said, "Prof, thank you for all you've done for me. I've just been made chief of infectious disease." Do you know what I was able to find out? That the matron in the clinic would document the number of patients that was seen by each doctor. You had that type of checks and balances. We need to document what did people do. When did they come to work? The laboratory person will have to justify working in the laboratory and getting paid. How many assays did this person run? It's not just about number. What did they do? So we need to, and when I addressed the chief executives and the chairman of the boards, I told them we need to do audit. We need to justify our pay. We need to work for our money.
How was that received?
Oh, I'm sure well received. We're going to do a retreat for all of them so that we can give them some guidance. We are going to strengthen them. We are going to do workshops. We need to document what people do daily.